The 2023 Joint Annual AIDS Review and the Symposium mark the third year of reporting on the National HIV-AIDS Strategic Plan. This year, the JA has been organized as a symposium that features the following: the National HIV-AIDS Exhibition that will create an opportunity to showcase the country's achievement in addressing HIV and AIDS.
HIV/AIDS in Uganda is primarily transmitted through unprotected sexual intercourse, multiple sexual partners, and to a significant extent mother-to-child transmission during childbirth, breastfeeding, or pregnancy. Injecting drug use, lack of awareness, and the stigma surrounding the virus also contribute to its spread. In Uganda, more than 1.4 million people are living with HIV.
The biggest problem is the communities we have who are vulnerable. And in this, we see more of adolescent girls and young women. They are more at risk because of the vulnerabilities relating to lack of employment, lack of money, not being in school, being marginalized by society, and also, of course, gender-based violence, not being, and that's in some societies, not being taken at the same level as their male counterparts. If you go to Kalangala, the population of men is higher than the population of women, and of course, sex is natural. So sometimes they are forced by that situation to start sharing sex partners, and that puts them at risk of HIV transmission. So we have similar groups that are like that. Young people maybe in populations or camps or congregations where they are alone. We see also a higher prevalence in the prison setting and others.
In order to lower transmission rates, efforts to battle the epidemic include addressing societal stigma, expanding access to healthcare, and encouraging self-practices. However, Uganda's goal of eradicating AIDS by 2025 may not be realized if the above is not adequately implemented.
When we are assessing performance, we compare with the target. So for some of the indicators, it is beginning to emerge that we may not be able to achieve our targets by 2025. So when we are assessing the national HIV response, there are parameters that we monitor. The first one is the HIV incidence, and incidence measures actually the number of new HIV infections in a given group of people per year.
Dr. Okoba Peter, the head monitoring and evaluation at Uganda AIDS Commission, notes that the Commission does coordinations of projects to end AIDS, though the implementation is left to other entities.
Remember, this is a multi-sectoral response. For us at Uganda AIDS Commission, we do the coordination. Coordination and implementation is by the different key players. For example, the Minister of Education, what are you doing? You have seen interventions to keep the girl child in school. There is Time Up campaign. There is Education Plus campaign that is aimed at providing proper information, appropriate information and giving the children what it takes to prevent HIV.
I think as a country we are really trying to build capacities of young people. That is information, services, even capacities for them to engage in such forums, to be able to speak on behalf of other young people. I think that is one area where we're doing well. One area where I think we need to really do better is to allow young people lead in the designing and implementation of programs, most especially those programs that are designed for us as young people.
It should be noted that there is a decline in HIV incidence and prevalence among adults aged 15 to 49 years. The new infections and annual AIDS-related deaths have been on the decline since 2010, but stagnated over the past 2 years at approximately 52,000.